Hi, welcome back to Medicare Mondays. This is our first segment of 2025. This session is being pre-recorded. Today, we will be talking about what is new for 2025. Let's start with Medicare Part A and new costs that are associated with it. Medicare Part A covers inpatient hospital services, skilled nursing facility services, home health care, in certain circumstances after you are in the hospital or skilled nursing facilities, and hospice care. Generally, people who have worked more than 40 quarters, which is equal to 10 years or more of work, they get Medicare Part A for free. If you did not work more than 10 years and you worked between 7.5 and 10 years, you would have a premium of $285 per month. If you have worked less than 7.5 years, your premium would be $518 per month. Part A has a hospital deductible within that area. It is set at $1,676 for each benefit period in 2025. Part A also has hospital co-insurances. Generally, you pay $0 for the first 60 days. After that, day 61 through 90, you would have a copay of $419 per day. If you, by any chance, go into your lifetime reserve days, which is after 90 days of being in the hospital, your copay would be $838 per day. Skilled nursing facility insurance, generally Medicare pays $0 between day 1 through 20, and you have a $0 copay. After day 20, your copay per day is set at $209.50 per day, and that will be day 21 through 100. Now we will move on to new costs in Medicare Part B. Medicare Part B covers outpatient medical services such as from licensed health professionals, preventative services, outpatient therapy, and home health services. If you are homebound and needed skilled care or lab tests, the Medicare Part B standard premium for everyone is $185 per month. If you are an individual that made more than $106,000, or if you are a couple with income over $212,000, you may see an increased standard Part B premium, which would include an IRMA. The Part B deductible is set at $257 per year. The Part B coinsurance for all services are 20%, should you have no other coverage other than Medicare Part A and B with a standalone Part D. New Medicare costs for Part D. Part D covers outpatient prescription drugs. Each year, Part D plans can change the drugs that they cover, the pharmacies in their networks, and their costs such as co-payments, co-insurance charges, and deductibles from year to year. Remember, there are two main ways that you can get Medicare prescription drug coverage. One way is Medicare Advantage plans that cover both health and drug all rolled into one. Or you can pick up a standalone Part D plan that works with Original Medicare. Remember, Medicare Part D is one of the required areas in Medicare So in order to avoid any late enrollment penalties, you should pick it up when you are first eligible at age 65. The maximum deductible in Medicare Part D is $590 for the year. And we have a new catastrophic coverage that individuals will reach, which is no more than $2,000 out of pocket. Let's talk about Part D coverage phases and changes in 2025. Previously, there were 4 Part D coverage phases. They were the deductible phase, the initial coverage period, the coverage gap, also known as the donut hole, and then the catastrophic coverage. Beginning in 2025, there will be just 3 coverage phases. There will be a deductible period, there will be an initial coverage period, and there will be a catastrophic coverage stage. In 2025, the coverage gap, otherwise known as the donut hole, is going away. What is Medicare Prescription Drug Plan? Beginning in 2025, you have the option to sign up for a payment plan for Part D out-of-pocket costs. The Medicare Prescription Payment Plan allows you to spread your drug costs throughout the year with the goal of helping you manage your monthly expenses. For example, if you're anticipating reaching the annual Part D cap quickly due to expensive medications, you can spread those costs throughout the year rather than paying a lot in the first month of the year and nothing in later months of the year. When you sign up for the Medicare Prescription Payment Plan, your plan will communicate your choice to your pharmacy. You should pay $0 at the pharmacy for your covered Part D drugs. Your plan will pay the cost sharing at the time of your purchase and send monthly bills to you for the cost sharing amounts. You pay no fees or interest, even if your payment is late. Remember, you have a $2,000 out-of-pocket cost for the year 2025. What is a transition refill? A transition refill, also known as a transition fill, is typically a one-time 30-day supply of drugs that you are taking before switching to a different Part D plan or before your current plan changed its coverage rules at the start of the new calendar year. Transition refills let you get temporary coverage for drugs that are not on your plan's formulary or that have certain coverage restrictions such as prior authorization or step therapy. Transition refills are not for new prescriptions. You can only get transition refills or transition fills for drugs that you are already taken before switching plans or before your existing plan changed its coverage rules. How is telehealth coverage changing in 2025? Before the COVID-19 public health emergency, Medicare telehealth coverage was very limited. For example, telehealth services were generally only covered in rural areas, only covered if provided via interactive two-way audio or video technology, limited to certain providers such as physicians or nurse practitioners. During the public health emergency, telehealth coverage was temporarily expanded to include more flexibilities and allow more people to receive care from their home. For example, during the public health emergency and through December 31st, 2024. After December 31st, 2024, most health services will again be more limited. Only some of the PHE flexibilities have been made permanent. For example, beginning in 2025, telehealth services will be still available regardless of your geographic area for certain types of care. Still be delivered using audio-only communication platforms for behavioral and mental health care, and subject to pre-public health emergency restrictions for other types of care. Medicare Advantage open enrollment period. During the Medicare Advantage open enrollment period, you can switch your Medicare Advantage plan to another Medicare Advantage plan or go back to original Medicare with or without a standalone Part D plan. The general Medicare open enrollment period occurs each year from January 1st to March 31st. You can only use this enrollment period if you have a Medicare Advantage plan. Changes made during this period will take effect on the first of the following month. For example, if you switch to a new Medicare Advantage plan in February, your new coverage begins March 1st. Unlike fall open enrollment, you can only make a single change during Medicare Advantage open enrollment period. Let's talk a little bit about special enrollment periods, changes in 2025. There are 2 new SEPs that are available to dually eligible people and or those eligible for extra help, known as the low income subsidy. There is a dual LIS SEP and an integrated care SEP. With a dual SEP, you qualify for this SEP if in addition to Medicare you have Medicaid, Medicare Savings Program, or extra help. You can make a once per month change either from Medicare Advantage plan to original Medicare with a standalone Part D plan, or from one standalone Part D plan to another standalone Part D. This special enrollment place replaces the previous special enrollment for those with Medicare, Medicaid, and MSP or extra help. If you have an integrated care SEP, you qualify if you have both Medicare and Medicaid. You can make a one per month change into certain special needs plans that meet federal requirements for integration and that offer a Medicare plan in your state. Other opportunities to change my coverage in 2025. If you qualify for a special enrollment period, for example, you move outside of your planned service, if you receive misinformation about your choices, you have LIS, low income subsidy, you have Medicaid, you are enrolled into the SPAP, which is called the State Pharmaceutical Assistance Program. In Rhode Island, we have a program called RIPAY, and that would fall under that SPAP. Additional SEPs can be found on the Medicare site and during annual enrollment period, October 15th to December 7th of each year. If you need to make changes to your coverage but you are not sure whether you qualify for an SEP, call your state health insurance program to learn more. The contact information for Rhode Island SHIP is 1-888-884-8721. As always, be aware of Medicare scams. Here are some red flags to look out for. Unsolicited calls from anyone claiming to be from Medicare. anyone needing your personal information so they can send you an updated Medicare card, anyone saying your card is expiring and they need you to send you a new one or you will be charged a fine, anyone stating Medicare is issuing new cards and they need to verify your number. And if you believe you've experienced potential fraud, contact your Rhode Island Senior Medicare Patrol at 1-888-884-8721. Remember, Medicare, Social Security, or the IRS will never call you to verify your personal identification information. Who to contact for questions in 2025 about your Medicare coverage? As always, you can always contact Medicare at 1-800-MEDICARE or 1-800-633-4227. You can contact your state health insurance program if you have any questions at 1-888-884-8721. You could contact your Senior Medicare Patrol, or you can contact your Medicare Advantage or Medicare Part D plan. Should you need more help with your Medicare or your other health insurance, please feel free to contact any one of our partner agencies listed here. We have Aging Well, Johnston Senior Center, West Bay Community Action Agency, South Kingstown Senior Center, Westerly Senior Center, The Point, East Bay Community Action Agency, the Leon Matthews Senior Center, Progresso Latino, Child and Family Services of Newport County, Edward King House, and of course we have our main Rhode Island SHIP and SMP line, which is 1-888-884-8721. Thank you for taking the time for viewing our video. With myself, which is Kim Timpson, along with my colleague, we help oversee the SHIP and SMP program for the state of Rhode Island. Have a great day.